about just off topic about the border, and I guess your reaction about it being delayed for another month.
Well, as I said, the decision made today by the Canadian government is it just is. There's no scientific reason to continue the closing of the border for another 30 days. Here we are at the Science Museum, and we have been told to follow the science, to follow the facts, to follow the data. And if you look at the Centers for Disease Control and Prevention, what they're saying is you no longer have to wear a face mask. You no longer have to socially distance because of the power of this medicine against the disease COVID. If you're fully vaccinated, you have immunity from getting COVID or getting COVID. Families should be reunited. People should be able to visit their properties. Business should be able to be transacted. So I wish there was a more artful way to say it, but at this point, there is no good reason given to the public for the continued closing of this border. Open the border. The President of the United States and the Prime Minister of Canada have the authority to open that border. I have been in contact with the White House. I have written to the President this morning asking loved ones who have been separated for 15 months to be able to reunite. And that's just following the science. We've all been told for the past 15 months, follow the science, follow the science, follow the science. We're following the science, and it basically says if you have been vaccinated fully, you have immunity from getting COVID or from getting COVID. So that's a big statement. Now think about this. 2 weeks ago, hockey players were given an exemption, right? That was arbitrary relative to the schedule of the Stanley Cup playoffs, having nothing to do with science, having nothing to do with data. And why is it that people who have been separated, who love each other for 15 years can't reunite? Why is it that people who have cottages in Thunder Bay and Bay Beach and Crystal Beach, fully vaccinated, can't leave their home in Buffalo and drive up to Canada to enjoy their property, to maintain their property? There's no other word for it other than, this is disrespectful toward the people of both the United States and Canada. Not to offer a vision about what it is you're going to be doing over the next 30 days to try to develop an opening plan. Nobody's suggesting that this be done arbitrarily, even though they did for hockey players. We're asking that we do a successful and safe opening by following the science. And the science is as clear as it can be. And if you look, you don't have to quarantine, you don't have to wear a face mask, you don't have to socially distance so long as you have been fully vaccinated, because nobody anticipated the remarkable power of this medicine against the disease. The hope was that we would achieve 60% efficacy rates. These are 90, 95%. They are effective, according to the CDC, against the variants as well. So there's no reason why this border has to be closed. Whether it's 10% of your population that's fully vaccinated or 45%, those people should be able to move. Those people should be able to move. And the other thing is, it's an incentive for people to get vaccinated. And everybody's talking about incentives. Well, you know what? A very powerful incentive is to allow people that are fully vaccinated to cross the border.
We've heard a lot from, obviously, U.S. officials about this, and what we've heard is open the border. Can you say, have you heard from the White House, is the hesitation coming from the Canadian side?
It is. There's a number of issues. Look, Canadians don't manufacture one dose of vaccine, owing to public policies about strict price controls on drugs and also patent duration. So the entire pharmaceutical industry has been driven out of the country of Canada. So they're not producing, so they're really not in control of their own destiny. That said, yesterday we moved 1 million doses of the Moderna vaccine to Canada. There are provincial, federal politics going on, but that's not my area of competence. But what I would say is you at least owe people an explanation as to what has been done and why the border can't open now and what will be done in the next 30 days to change that. We're going to engage with federal officials in Canada and the United States, Canadian public health officials. If we can achieve these objectives, we can open the border. People are deserving of that kind of clear communication. It is not occurring. And I just think that it's a terrible disservice to both the people of Canada and to the United States not to communicate that clearly.
We talked about this before, but as this continues to go on, when is it time for the United States to say we're doing this unilaterally?
That's what I asked this morning. I've been in contact with the White House yesterday, and I wrote to the President this morning saying, let's open the border unilaterally. Let's allow the category of essential traveler to be expanded to include reuniting loved ones, people that own property in Canada from the United States. This is about reach and frequency. We have two obligations. One is to be very honest with people about what's going on, and the other is to keep trying. And we just have to keep on trying.
Thank you so much.
Thank you very much.